The healthcare system in the United States has always been a problematic topic, and the COVID pandemic only made it worse. During less than 1 year of the pandemic, the US lost as much of its population as in 3 years of World War II. Why do things happen in such a way? How do we fix the problem of healthcare? We will explain in this video. The situation when one of the most powerful states in the world can't provide its citizens with basic needs is ridiculous. Unlike many other industrialized countries, the United States does not provide universal healthcare coverage to its population. Rather, the US has a complicated system of employer-sponsored health insurance, with state and federal programs playing a supplementary role. As such, workers are largely relying on their employers for healthcare coverage. The majority of the population has private insurance through their employer, which means job loss can lead to the loss of insurance coverage for many. The cost of medical care in the United States is extremely expensive, with double the cost of the average OECD country. With such extremely high costs, there is a growing number of Americans who have medical debt. 41% of working-age Americans, or 72 million people, have medical bill problems or are paying off medical debt, up from 34% in 2005. One contributor to high medical costs is the high cost of pharmaceuticals. Pharmaceutical companies are able to obtain patents for drugs that are developed and reap monopoly profits far above the price of production. One notorious example of this practice occurred when Martin Shkreli increased the price of a life-saving drug called Daraprim from $13.50 to $750 overnight. Looking at the pharmaceutical industry as a whole, the top 25 drug companies had an average annual profit rate between 15 and 20% during the years 2006 to 2015. The average profit rate of the largest 500 non-drug companies was between 4 and 9%. Under the guise of rewarding innovation, these companies reap the benefit of their monopoly position, which results in high drug prices and unaffordable medication. Insurance companies are also guided by the same principle of profit maximization, which means revenues exceeding expenses, even when the expenses relate to a person's health and well-being. Due to the private ownership of the means of production, the profit motive underlies all facets of American healthcare, from hospital and dental care, to health insurance, to pharmaceuticals, medical device manufacturers, and so on. The structure of the healthcare system leads to high-cost care that fundamentally serves the interests of the oligarchs and the wealthy. Even prior to the epidemic, the US ranked poorly in terms of life expectancy and infant mortality compared to its peers. So if the US system is extremely expensive and does not deliver great results to the public, who is benefiting from the current healthcare system? The executives for the healthcare industry have reaped massive profits in recent years. For example, in 2019, Gilead Sciences CEO Daniel O'Day made $29.1 million in compensation and was the highest paid in the industry. 19 of the 100 highest paid CEOs were in healthcare. The capitalists are able to obtain massive profits from the current organization, regardless of the consequences for public health. As the coronavirus pandemic has led to the deaths of over 300,000 Americans, the question of healthcare in the country is more pressing than ever. Over recent months, the number of cases in the United States has risen to 17 million. Even before the coronavirus pandemic, over 71% of Americans thought the healthcare system was in a state of crisis or had major problems. Now that a major pandemic is spreading rapidly across the country, the weaknesses in the system are more apparent. With the rate of daily infections increasing, intensive care units are being filled to capacity in states across the country. Hospitals are running out of beds to treat their patients, and healthcare workers are under great stress. While millions of people are currently suffering from the negative effects of the pandemic, the capitalist class continues to profit. In fact, the COVID pandemic has dramatically increased the wealth of the capitalists in the healthcare industry. For example, over the last several years, the wealth of the healthcare billionaires increased by 50.3% to $658.6 billion, due in part to drug developments in COVID-19 treatments and equipment. Moderna and Pfizer are expected to make billions from the development of the COVID-19 vaccine and its distribution and sale. As such, opportunistic investors were able to amass greater fortunes, while over 300,000 Americans have died from COVID-19. Thus, we can say that the US system of healthcare, due to its capitalist organization, has a complex, decentralized structure that is profit-oriented in nature. The fee-for-service approach to healthcare simply leads to the enrichment of investors, corporate executives, and the business owners at the expense of the public health. On the opposite end of the spectrum, the low-income workers forego medical care due to the great costs. Those with lower incomes are more likely to have health problems, such as smoking, obesity, and substance abuse, and the least likely to afford medical care. The profit motive also affects the healthcare workers' workloads and their ability to provide adequate care. One example of this interaction between profit and management would be nurse-to-patient staffing ratios. In an effort to reduce labor costs and increase profits, hospitals reduce staffing and increase the number of patients that each nurse cares for. While this arrangement benefits the capitalists, it is exploitative for the workers and interferes with the workers' ability to provide adequate care to patients. The main argument against the state healthcare system is that it would be too expensive and the budget won't be able to handle it. Modern capitalist countries such as Canada, Australia, Norway, Sweden, and Denmark utilize such healthcare systems, which all have lower administration costs than the US system. Likewise, the USSR was able to provide free, competent healthcare to the entire population. So this means that the problem of healthcare isn't simply finding the money for it. Most Americans are aware that there are fundamental problems with American healthcare. However, it is also necessary to identify the root of the problem. The affordability and inaccessibility of healthcare are linked to the nature of capitalist production, whose cornerstone is profit. The socialist system would be able to provide healthcare to workers as a right. In fact, the citizens of the USSR had free healthcare for workers enshrined in its constitution. Healthcare was not restricted by the bounds of the profit motive and its accompanying anarchy. On the contrary, the socialist economic system is planned and centralized to increase efficiency and provide high-quality healthcare to all the working people. The way to advance beyond the current limitations and shortfalls of healthcare under capitalism is the establishment of worker control over the means of production and an end to the rule of capital. So, as we can see, the healthcare problem isn't the problem of the money, it's the problem of the capitalist society, where the minority owns everything while producing nothing, and the majority owns nothing while producing everything. Capitalists have almost no interests in workers' lives, and this means no one can help the working class except themselves. How do we do it? Study Marxist theory, organize the people, and join us in the struggle for a better life. Stay tuned.